Thank you all for being here, the panelists. I'd like to introduce William Miller Jr. from Be More Power, Claudia Jackson from Anne Arundel Power, Jesse Dunleavy, harm reduction advocate, Katie Edwards from Senator Elford's office, and Michael Drummond from Arundel Lodge. And if you all could just do a quick introduction of yourself. 90 seconds.
My name is Mike Drummond. I'm the Executive Director at Arundel Lodge, which provides a comprehensive and wide range set of services for people with mental health and substance use disorders. We have residential group homes and 3-person homes that include 32 homes throughout the county. We have 2 outpatient treatment centers for substance use disorders and mental health. We have a lot of variety of psychosocial supports for persons with mental health disorders and co-occurring. And we're very committed to being partners with the community, with the city of Annapolis, with other service providers, with advocates to help create the supports that our community needs to move together to a more healthy place.
Hello, I'm Katie Edwards. So not only do I work with Senator Elford, but I also work with the Annapolis Lighthouse, and I manage workforce programs there. So if you're really interested in talking to folks who are really passionate about getting folks who have experienced substance use into workforce development, because that's my passion and that's what I do for my full-time job. But before coming to Annapolis, I worked on a mobile, sorry, I'm a little nervous. I'm gonna get through it. You guys are here with me. Okay. I worked in a mobile harm reduction unit in northern New Mexico, assisting folks at their homes doing syringe exchange, Narcan distribution, tool distribution, clothing and food distribution as well. It was extremely successful. We would go through about 3,000 syringes a day, and it was large capacity and extremely successful outcomes. So that's what I'll mostly be speaking on today, with some highlighted efforts from the Lighthouse.
Hi, I'm Jessie Dunleavy. I've lived in Annapolis all my life, and I am an advocate for harm reduction and, in general, just reducing the harms for people who use drugs. And I do that through opinion editorials and affiliation with various groups, the Baltimore Harm Reduction Coalition, the Maryland Harm Reduction Action Network. I'm on the Annapolis Substance Abuse what's it called, Angel?
ASAP.
I have so many acronyms in my head. And also at the national level, the Drug Policy Alliance. And I've advocated for my cause within the Maryland General Assembly. And I work with TOLA in the NAM committee. So nice to be here.
I'm Claudia Jackson. I'm with the Anne Arundel County Health Department. I'm the Prevention Program Manager, where we provide system training, education, and prevention services. I'll be highlighting our H.E.A.R.T program today.
Good morning. My name is William Miller Jr. I'm one of Be More Power coordinators. POWER's acronym stand for People Offering Wellness Education Resources. Also a member of the Bridge Coalition. If any of you been to Annapolis, and we're going to safe places to for people to use drugs and be treated with dignity and respect. That's a part of the Bridge Coalition. Also part of the Maryland Harm Reduction Action Network. I'll let y'all know what we do as we speak. There's a whole bunch of stuff going on with us.
Thank y'all. So, harm reduction is defined through www.harmreduction.org as a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement for social justice built on a belief in respect for the rights of people who use drugs. The question we had, and then so this is, what does harm reduction mean to you? So do you agree with the definition of harm reduction? And if you do or don't, which I'm sure but you know, what does harm reduction mean to you?
I'll take it off. What harm reduction means to me is most of the things that haven't worked, isn't working, and being uncomfortable trying new things, untraditional of ways of bettering people's lives at their own terms, and it's person-centered. So just a couple of things. I heard Narcan, treat people with dignity and respect, but we never talk about the needs, the basic needs. Hot water. How many people took a shower before they got here last night? So things that causes a lot of harm to people, and that's some of the starting points of people to start to use drugs. And I heard trauma, but I didn't hear ACEs, adverse childhood experiences. So that's another factor into it also, which I'm a person of that. I think I turned out all right now because I take my medication, but it's a lot of factors that goes into it, and just harm reduction in general to me is meeting people where they are. People say that they like really meeting where they are, going into the woods. Like someone was just talking about the bus stop and making sure that, pawn shop and things like that. It's a lot of places that we don't think about that people go to Hubbard to either get drugs or hang out or whatever they do. So that's, I think, untraditional ways also.
Harm reduction for me, expanding on what Will said, is actually speaking to the community in which the programs affect. So as we build and service people, we want to make sure that what we are giving them or providing for them is what they need. And the best way to gain that knowledge is to have conversation. So just surrounding that and then providing the resources in a way that they can access them with virtually low thresholds or no barriers.
I got this one. First of all, I want to say that I am in support of the Break the Stigma mantra, and the more we can all focus on that, the better off we'll be. But it's difficult to get the general public to back off of some of the beliefs that they have and the stigma that really impedes progress. Because if you think about it, our lawmakers have the ability to change some of the laws that may be working against our cause, but they're answering to their constituents, and the constituents don't really have the understanding. And most people, once they learn what these people are up against and what we can do for them and treat them like human beings with dignity and respect, they can get on board. But we have to stop the stigma. But we're in a difficult position because it's hard to separate out stigma from a condition that this country incarcerates you for. So that's where part of the big problem comes in. And so I definitely believe that the last thing we need to do with some of these people is incarcerate them. And so that's just one part of harm reduction, because what we're trying to do is reduce the harms of drug use. And I couldn't agree more with Pastor Cheryl about the people who fall into chaotic use. They're the ones that have had an unfortunate past, they're afraid of the future, there doesn't seem to be anything life has to offer them, and then we further shame them by putting them in jail. And then they're at a disadvantage when they finally get out. So I am very much an advocate for decriminalizing and helping these people instead of further shaming them. It's the last thing that they need. And I agree with Tola's definition on harm reduction. It is definitely a humanistic, human rights driven, take care of the people, and there are many ways to do it. So there are strategies, and I believe in every single one of them. I think we should have the entire menu and not pick and choose, have them all. And I agree with Claudia that you have to work with the individuals and give them the choice. And I also believe that there's an unfortunate, sometimes perception that people who support abstinence and people who support harm reduction are working at odds. And really, that shouldn't be the case. We all just want to make life better for these people who have fallen into this terrible problem. And so abstinence is one form of harm reduction, but there are other forms, and we work our way along depending on where people are. So people should have the choice with regard to medications, they should have the choice with regard to treatment, and they should have the choice to get clean syringes if that's what they need. And so again, there's a philosophy and then strategies, and I'm sure we'll touch on all of that.
I believe harm reduction is everything that has been touched on. You all did a very good job of covering all of the points. So to keep it simple, empowerment, education, and removal of barriers at all costs.
So I would concur that the rest of the panel has done a very good job of covering what harm reduction is and what it means. What I would add is it starts with an acknowledgement that there are people who are not ready to acknowledge that they need to change their substance usage in any way, who may not see the relationship between how they're choosing to deaden the pain that they've experienced from previous or current trauma. But they're out there, and they're people, and they deserve our support, and we will only distance ourselves and marginalize them further if we don't have any ways to support people who haven't made a plan or who aren't currently taking actions to reduce their substance use. It means providing supports to them. So housing is both harm reduction and it's also treatment. People can't solve a substance use disorder, a mental health disorder, or any other physical condition they have if they don't have housing. So housing first is an example of a model that says, we're going to house you, and then we'll deal with the other problems that need to be addressed. I have an example of a friend in New York who following a housing first model, someone had a tremendous alcohol addiction. They housed that person, and within a month they were facing potential eviction because we kind of sit outside, throw beer bottles wherever they would go, and because of his littering and impact on the community, he was already facing addiction. What they implemented in terms of a strategy was that they bought him a big trash can and put it in his apartment and said, you are going to be evicted from where you're living unless the bottles go in the trash can. And the bottles went into the trash can, and after a while, he could see how quickly that 32-gallon trash can was filling up with beer bottles, and it began the realization that, hey, I'm spending a lot of money on this. Maybe I could drink a little bit less beer as a result of that. But people need to be safe, they need to be protected before they can change something that becomes so central in their coping, which may be a substance use problem.
Thank you all. Next question. What barriers do you think exist that may challenge modern harm reduction principles and models in the city?
Any harm reduction strategy that we don't have available is a barrier. And so I think that's important that we have the whole range. And some of that isn't the city's issue. It's like you said, we're a city within a county, within a state, within a country. And there's so much controversy over these initiatives. But Anne Arundel County doesn't have a clean syringe program. And Prince George's County does, Baltimore County does, Wicomico County does, but we don't. And so I think that's an impediment. I know for sure that people who use drugs that they inject, they use dirty needles, they get HIV, they pass it on, they suffer from abscesses, when in other places they can go and get clean needles. And that touchdown, let's just take that as an example, whether it's clean needles or Narcan or whatever it is we have available, that touchdown with somebody who's there just to hand you something to help you is what gives these people the feeling that they don't have to hide under a rock, that they don't have to live life in the back alley, and that there are people there who they can talk to and trust, that aren't there to arrest them, but to help them. And those relationships are what lead to seeking treatment. Not that that's always the be-all and end-all. And you know, most people who use addictive drugs do not become addicted. Most. Those who do, 80% recover on their own without any treatment. That gets no media coverage because it's not sensational. The 20% who get addicted and do need help, again, are the very most vulnerable. Mike and I had the pleasure of listening to a man named Darwin Fisher speak in DC last year, and he's the executive director of a safe consumption site in Vancouver. And he said for some of the people that come in there, it's the only indoor space they have. And so they're coming in there the first time maybe to get a clean needle, the second time maybe to look at job placements or to inject their drugs and get Narcan if need be, or whatever other mental health, physical health, mental health care they need. But so many of them now are seeking treatment, and so it's proven in similar places throughout the world, there are 120 of them. We don't have one, certainly in Annapolis, because there aren't any in the country. So again, we can't beat ourselves up for that. But there are things, that's right, and safe houses as close as we've gotten in Philadelphia. And so I'm hopeful about that. But I also want to say that we have the highest overdose rate in the world, by far. We have 3.5 to 28 times higher the number of overdose deaths in the United States compared to other modern countries. And we also have the highest incarceration rate. We have 5% of the world's population and 25% of its prisoners. And we spend more money, by over $10 billion more each year, on housing people that are incarcerated than we do on education. And we have all these initiatives that we fight the war on drugs over and over and over, and the death toll is unaffected by it. So I know I've gone beyond your question.
I think a large barrier to harm reduction strategies is just not being aware that they're there. And once you educate the community on the resources that are available, you have to present it in a way that they can access them. And that's where I think the power model comes in. And, you know, one, just showing up consistently, not bringing the resources one day and then you don't see the community again for weeks or months. But every week, every day, you're showing up, you're out there, you know people by name, you ask them, is there something else I can add to the table that we don't have right now? Is there something that you like to talk about, and have, you know, the person that you're sharing the conversation with around health be the driver of their own change and tell you what it is they need, rather than, you know, you telling them what it is that's best for them, or setting their norms compared to your own. Will, did you want to explain? It's on.
Some barriers, it come from the media. Somebody said that, it come from the media. We hear about all the overdoses, how many people have died. It's probably twice as many that have been saved from naloxone also. That's never glorified in the media. Secondly, just being real, being truthful, educated. And the truth is, a lot of people don't accept people who use drugs. And I always get this, I never thought of it like that. I'm a person who identifies as an active drug user. Don't get rattled. But a lot of deals in Annapolis will be made around the table of people who are using drugs. And what I'm saying is, people forget that Merlot, that red wine, that's a drug. But it's a different substance that we stigmatize and label people about because of the type of substance they use. Another barrier is a group of people that's missing are people who sell drugs. And we want to take away and lock them up. And we have nothing to put in place for it. And they just trying to make a living also. So I'm an advocate about people who sell drugs that's trying to make a living, because I was that person. What we put in place for it? And people writing grants and proposing things like that, think about getting some of the people who are using drugs. I mean, people using and selling drugs, because some of them the same people, like an accounting workshop. Think about it. And it's no safe haven. Most of the safe havens are churches where people can go. Libraries. Officers are allowed to go into libraries, but not the churches. So, Jesse was just talking about all the safe consumption places around the world, and there is one that exists in the United States, somewhere in the United States, but it's not legal. But this is being researched and evaluated as a legal one. No one ever died in any of them. But, and again, I always usually start off with this. I hope I don't offend anyone. That's not what I'm trying to do. I'm just speaking the truth. And these are some of our barriers. And the race car always come in fact of it. You know, that's not my thing. That's a Baltimore City thing. That's a PG County thing. That's not an Atlas thing. It's a worldwide initiative that some of my colleagues are doing. We just came from a DPA conference and we're finding out, because we're just talking about opiates right now. With drugs in general, you have people that's getting snatched and getting put on these farms to actually work. I mean, and it's children, women, pregnant women, things like that. And that's another issue of the transportation. Claudia talked about it. So I took initiative on my own time because my 10-year-old daughter, who's been doing the naloxone training since she was 8, because it started with the children. Children who's in elementary school is curious. Middle school, they may start smoking a blunt. So we have to be mindful of that, and let's stop. Well, for me, I don't never want to be uncomfortable about talking about anything and anywhere, any room, because it's what's going on, and if it's not a conversation being held, how will we know? There's some of the barriers because it's hidden. It's hidden. You know, the word unintentional overdose don't stick with me. Who overdosed on purpose? You know, so these are the things that I'm allowed to be in some of the rooms where I believe a lot more people who use drugs should be, if they can manage their drug use. And I know many people who can. And there's some other people on Congress, which I found out because I had a chance to go to Capitol Hill, use maintenance assisted treatment program.
Wall Street too.
Yeah, you know, I ain't been on Wall Street yet, but these some of the barriers that I know I'm faced with. And again, to each city, each little town, is how you incorporate it. And again, support is the biggest thing. The word peer support specialist, I am a peer support specialist, I'm a peer support specialist supervisor, but some peers are being left. And what I mean by that, that's all you're gonna be, just a peer. But they're able to write reports, they're able to be to work on time, and again, not to offend anyone, there's a lot of people that I work with, come to work late, never get their reports on time, but they're at a higher standard. So it's classes that we're in also. So these are some of the barriers, and there's plenty more, but I don't have enough time.
I'm not Tola, so he didn't shapeshift, but he has some other things he has to attend to. But I wanna say, you don't have to apologize for the real talk, in particular because, as worded, we want to talk about barriers, and one of those barriers that allows that to be a subject matter that we're talking about is the barrier of not having real conversation about what the real issues are. And I think a credit to a lot of you all around the table who have been involved in NAM and other outreach efforts and information dissemination is that in this city, as you pointed out, one of the barriers is it's politically incorrect and otherwise, socially, to talk about what people are struggling with in their individual homes. And that's a barrier, like you said. I mean, we need to break down those walls and have these conversations. So thank you, and don't apologize.
One more barrier also, who we vote for.
Yeah. We're gonna stay away.
No, I'm just saying. Are we red or are we white? I mean, red or blue?
Well, did you hear last night in the debates? How many of you all saw the debates last night? You know, Cory Booker and Kamala. I mean, they touched on exactly that in reference to kind of Biden's vantage point on medical marijuana and the legalization. And so it's incredibly appropriate, because having that conversation about really being clear about how do we meet the needs of people, constituents, citizens, whatever you want to call it, how do we meet those needs? And so a barrier is us saying, well, what do we want to do from our office and from our vacuum, but what do people really need? So you touch on a good thing. I think you wanted to say something. And then, you have it. Sorry.
So, I think talking about different barriers, Jesse had mentioned earlier about the war on drugs and criminalizing substance use, and part of the reason why that was possible, I think, is that people saw the drug users as the others whom the rest of us needed to be protected from, rather than seeing really that drug abuse is something about us and coming together. And so I think the One Annapolis is an approach to try to bridge the barriers that exist in Annapolis. Race is another barrier that exists in Annapolis. And I think recognizing again that the issues of substance use don't have anything to do with race, but it does have to do with trauma. And one of the things about incarcerating substance users was that it increased the trauma that they and their families were experiencing. So if someone was incarcerated, it meant that perhaps a breadwinner in a family was lost, the relationship between that person and their children and their spouse was lost, and it increased the trauma instead of decreasing the trauma. So I really think that supporting each other and coming together and addressing directly the history of race and the way racism, sexism, and anything else has impacted our ability to support each other has increased the problems that we've had in improving the lives of people.
Absolutely. I will, as we go for the next comment, to that point, one of the barriers, and some research has shown, and it was actually one of the recommendations brought down, was zoning. And for you all that are practitioners, and for those of you all who work in that field, you understand that zoning has a lot to do with where houses are held, how people can access treatment, because it has everything to do with if you live in a certain area and there's a desert, like we know what food deserts are, there's also desert areas where populations of people do not have ready access to treatment. And that's a very real thing and a very real barrier, so thank you for that.
So just to speak to the first one, I believe we face the overarching problems of society within harm reduction, which is what makes it so potent and so important for us to all be here. Oppression, racism, sexism, you name it. It's in harm reduction, and we are all activists in trying to face it. Something that I've learned in the short period of time that I've been involved is a huge barrier is working in silos. When we get caught up in our own field and decide this is the only way that I can help, and we lose perspective of, let's say, the people on the ground, the people doing that very hard work. We forget that perspective, or we forget the neighborhood next to us and all the barriers that they're perceiving as well. We think this is our job, this is all that I can handle. But through collaboration and working with one another, that's where healing occurs. That's where we can start seeing the other and erasing it, where it can go away. So I would just say that is the most potent start that I've seen in a community where that other begins to dissolve, where the police department, where the fire department, EMS, everybody is working in a seamless flow to support not only those on the ground, but all systems of care, so everybody is informed. That is where, that's where the barriers start to be removed, I think. So this is an amazing start to that. Yes, absolutely. There's a lot to say about racism. I think we all agree. But to move on to the zoning, or should we focus?
It's totally on you.
Okay, we can come back to it. So when I worked in a mobile harm reduction unit, we were able to give out Narcan, do syringe exchange, and we were able to do all those data tracking points that you guys were really excited about, like how many people were you able to save with Narcan as a drug user right now, and do an empowering message, get the data that we needed to report back to the federal government. So that was a really great touchstone in which we could approach multiple problems at once, but it also allowed us to sort of go beyond the zoning laws at times, where we could, there would be a zoning law that went through someone's driveway,
and we would say, meet us at the end of your driveway. And we could ask people to meet us at corners of their neighborhood in order to do these services. So I would just emphasize the necessity of mobile harm reduction units throughout Anne Arundel to solve a lot of those issues.
Thank you.
Just before we got off of the racism piece, I wanted to say that the laws in the very first place were racist. And now the incarceration rates are shocking. If you look at the percentage of people in this country broken down by ethnicity, and then look at the percentages in the state and federal prisons, there are more black and brown people than white people. When you look at the bar graph, it flips when you look at the people, the whole population. And so it just turns your stomach that we would treat people so differently. And we will go into a bad neighborhood and arrest people for marijuana possession or some minor infraction, and we won't go on the campus of Columbia University and arrest those people for the same thing, which they do every day. So we have so many racist ideas that we have to break down, and so we have a long way to go. But the other thing is, harm reduction quite simply saves lives. And there is a whole list of strategies, and we can go over them at some point, but we should have every single one of them.
Also to add is to change the narrative. So when we're doing street outreach, instead of focusing on the fact that at the moment we don't have a certain service program, but what I can share with you and give you is maybe some bleach and sterile water and show you or just talk with you about some strategies on cleaning pre-used syringes. And that just sparks the conversation and the trust that this person is giving me some strategies that are relevant to my life, and she's out here all the time. So that may open the conversation and the trust level to where they're now sharing other things with me and allowing me to bring back tools and education, or folks who have been in that situation to maybe better relate, to say, you know, I have someone else who can better assist you in this. And then, you know, each one teach one and move on. But it does take the community, because Will and I can't be on the street just by ourselves. And yes, you want to hire folks, but if you can't hire them, we have incentive-based volunteer positions where we could talk to a resident coordinator who could simply put the word out there. Hey, we have a program that wants to come into our community, and just by her saying that, and the community trusts her, so if they see us standing together, then, you know, they'll be more inclined to assist in the war on drugs.
So I want to elevate one of the key pieces, and then we'll move into a Q&A with the rest of us, and then develop kind of mainstream our strategies for this panel, or recommendations. And one of those is that I've kind of heard someone bring up, which is a huge barrier, which is accurate, timely, and contextualized data. Right, so it's one thing because data can be manipulated, but also data points can be overlooked as to the impact it has on actual people on the ground. So can any one of you all speak about some of those barriers as it relates to collection of data and how that's contextualized?
Just learn a little bit about data. It's like see something first, but it's hard to read. First and foremost, how raw is the data? When did we get the data? How qualitative is the data? These are the questions that, you know, I had to learn to ask and look for. Because if you go in a neighborhood predominantly white, that's for the white population. But we missing the LBG, you know, we missing a lot of populations. So it's like incorporating all that, which is hard. That I found out also. But my friends at John Hopkins, they do a wonderful job. That's what we work with closely, and that's how I found out some of these things. But there's some of the barriers of getting the data. You have to pay for the data. Then you gotta know how to read the data. But my job sometimes is not just I mean, it mostly taken into the street for the people that's affected the most. How can I disseminate that? That's another thing I advocate for, like a data workshop, things like that. So write that in your proposal grant too. I would do TA also. So that's technical assistance for all y'all don't know. But they are some of the things that can't be disseminated. And coming from a place where some people come from, like we go in where a lot of people do research, the data just clear, they know it, they know what's wrong. But when we take it to people that we want to go to testify in Annapolis for various issues, how can they disseminate this data? And it's really hard to get all the good data. And some data just come like at the people on the ground. We already knew about that. We already did that. We already knew. But the data is really valuable for funding standpoints. But it's how can we disseminate it and get it to the people that need to learn how to talk to when they talk to an officer who arrests them for because they don't know their rights. That's something else about it. We need to know our rights. I'm gonna stop right there. I got a lot more.
Do you mind if I speak to one aspect of it?
Yeah, go ahead.
I think also something that everyone has spoken to is how data is framed as well. We've spoken about so many positive things that have come out of the harm reduction movement and how those are rarely ever spoken to at a national level about how many lives are saved, how many positive things we do for each other, but that's not what is publicized. What is publicized is how many people are dying, how many people are addicted to substances, and we focus on the negativity as opposed to the healing that is happening in the community. And I would just address that point as well.
And in terms of data, I'm going to repeat myself, but I don't know why this country doesn't look at the fact that we have by far the highest overdose death and by far the highest incarceration rate. When we have other countries that have model programs that have done away with restrictions on medications that are a good option for treatment or even harm reduction, they've taken away these restrictions that we have imposed, and they've also have safe consumption sites so that these people are cared for and have a safe place to go. So more people reach treatment with harm reduction. And so I don't know why, and that data is so clear, but we don't look at it, the media doesn't report on it, and also it's not an opioid overdose crisis. It's a drug overdose crisis or an overdose crisis. It is not opioid. I'm sick to death hearing about opioids. It's really not. And we're over-focused on prescription drugs because that is not the problem. And what's the problem is the war on drugs has blocked the big shipments coming in from our southern border or from China. We're scanning postal packages, and so we're blocking these drugs coming in. So the cartels aren't going to take a hit. They have developed more potent drugs that they can smuggle in smaller packages, and so there are just as many drugs on the streets as there were before we were fighting at our borders, and the people are dying at a rate we couldn't have fathomed 10 years ago because of the fentanyl. And really, I'm not saying that the people fighting the war on drugs intended to kill more people. I don't think that, but they're not looking at the results of what they're doing because in effect, it is killing more people.
Absolutely. I want to take a shameless plug, a commercial, if you will, really quickly for the city staff who provided us with our audio visual, sound, and filming it, and for their tireless work, and it's Julie Jack and Kate. So I just wanted to acknowledge that, and also acknowledge our assistant city manager, who is right here. Her name is Lynn Farrell. Happy to have her on board. So please stay tuned for your regular programming.
I just wanted to bring it back to a local level and that to acknowledge the OD Free website. So if, because we base a lot of efforts on the data and we put our resources where the data tells us the community is most at risk, and law enforcement has done a wonderful job here in Annapolis with getting the Office of Emergency Management data so that it can be reported in a way that anyone can go to the website and see where the overdoses are happening. I believe it was pictured earlier, and you can just look at the bar graph and see that in Ward 6, there were 42 overdoses. So when you are thinking about where the programs and their efforts and why they're in that community and not your community, yet you know overdoses are happening, you have to be an advocate and tell your community to report, because if you don't report it, to the people who are not on the ground, it's almost like it's not happening because we don't know about it. Until we can figure out a way to capture unreported overdoses in an organized way, then all we can base our decisions on is the reported data. So I would encourage you to visit the OD-Free website frequently to make sure that your ward here in Annapolis is represented. And it also shows the different drugs that are being utilized and in which folks are suffering overdoses from, as well as age and race. So there's a lot of information there that we as a community can help to make more accurate.
Wow.
Can I do since we're doing role plays?
Absolutely.
So we were talking about strategies, and to be real again, realistic, people gonna use drugs. So what Be More Power did, came up with a Go Slow campaign. I don't know if y'all seen that, and it's just about having a plan. Having a plan. And people are like, oh, they crazy. People gonna use drugs anyway. You gonna tell them not to do it? Prevention is mean like stop. That's what some people looking at. It really don't mean that. It's like slow down. But it's like having a plan. Again, when we go drink this Merlot, rum and coke, the plan is not to drive, get an Uber to Lyft. So that's how I think about it. And you can just Google it. We're on Facebook, Instagram, and it's about fentanyl test strips. And when I talk about fentanyl test strips, people think about opiates again, Jesse. It's in pills. It was a whole bunch of Percocet 30s floating around Baltimore City. How I know? Because I'm in the trenches. I still have a life outside my job. And it's about doing self-care with yourself too, because it's really, really strenuous. And another thing about the data, it's about, we never get the data about how many people from out of town, from different cities that overdose in your city. Because Baltimore has a high overdose rate, all of them, not else.
Well, and it's interesting because it's speaking about data and people and kind of imaginary lines, right? So think of like Cherry Hill. Think of immediately when you get over into Brooklyn but if you look at our data, and there was a map that was on a PowerPoint that I put on there that shows right over the line, right? So when they say North County, you see a huge number. But a lot of it has to do with exactly what you're saying, because we're not able to say how many, and so attributing it to like this territorial thing can be an issue and a barrier also, because really we're dealing with humans who tend to be transient, right? We all tend to be somewhat transient in how we move. So anyway, I wanna also give an opportunity with time for our attendees to ask questions of you all. To kind of elicit some deeper thought around things. So if you don't mind, can you all share the active mic?
Yes, I'm Archie Trader. I moved to Baltimore City when I was 19 years old. I went to Morgan State University. I grew up in Annapolis. The first time I saw a homeless person was when I moved to Baltimore City. The first time I saw a lot of things is when I moved to Baltimore City. One thing that was amazing to me is the heroin addiction. Baltimore City must have been addicted for 100 years. That's exaggerated, but it's been there for a long time. And I'm glad we are where we are in terms of our fight against addiction. But Baltimore's been there for a long time, and not a word was said. So I asked this question: what is going on in the elementary schools, in the after-school programming, in the out-of-school programming, to educate young children in the anti-drug movement? What is going on there? Because I've seen generations addicted to drugs, one generation to another. As a correctional officer for 20 years, I've seen guys come in with pus, their holes, abscesses of their legs. You can see straight through the bone where they've shot up, and nothing else was left but the areas between their toes. I've seen generations of this. What's going on the elementary school level? What's going on in not only Baltimore, but everywhere, to get children to understand how serious this is, to break that cycle of generational addiction.
I can't speak to this as much as maybe some of my friends on the panel can, but I can tell you that scare tactics don't work, and that we need to treat our children as the intelligent people that they are and give them factual information. And I like the phrase, instead of just say no, N-O, just say no, K-N-O-W. Wow. And give these kids a harm reduction curriculum.
Well, if you notice in my question, program. How do we program our young children?
Yeah, I can't get into.
I'm gonna trademark that, so.
So I'll speak to my experience in New Mexico, where the crisis was going on for 40 years, which is how we got to a stabilized mobile harm reduction unit in that area. We were not allowed to go into elementary schools, unfortunately, but my team, because we were in a SAMHSA federally funded grant that did prevention services and were able to tie into harm reduction, went to the high schools and we did Narcan training. There we were able to distribute facts and figures around their community that was dying at very high rates and empower them to save people's lives. And in that space, you would see this transformative effect on the children, where they would talk about lives that they saved, their uncles, their fathers, their mothers, their siblings, and it would be heartbreaking, but that would change the whole mood in the entire school, where people felt that they weren't kids anymore. They were people that could change and save people's lives, and they knew how to do it. So it works. It's a big fight to go into the public school system. They don't want it. It is very conservative based. I'm going to tell you ahead of time. But if you can push for it as a community, they will allow it. It just takes a lot of fight.
Other countries are doing it, FYI.
And one of the dangers of doing education from only an abstinence model as the only way to help somebody is that the children who go to just say no sorts of education in their school go home to parents who may be IV drug users or using cocaine or any other drugs, and that just furthers their feeling of powerlessness because they can't make their parents stop. But if there was a message to children about how to support people, and it's an unfortunate reality that sometimes they feel like they need to take care of their parents. If there was a way to help them understand their parents and what kinds of things might be able to help them, then that might give them more hope, not only about their parents, but also about their own future.
Here in Annapolis, we do have a Strengthening Families program that's located in the school, after school. And so what we try to do is utilize our ambassadors, like the counselors who are advocates for the program, to push the program out into the school, while behind the scenes we work with the Board of Education and the principals at each school and try to work on the buy-in to allow programs into their school, because ultimately it's their decision. But in the meantime, we can utilize someone like Pastor Cheryl, who's already in the school, to say, hey, Pastor Cheryl, I have this program. Can you talk about it in your meeting? And just utilizing the person that's already at the table until we get more people at that same table.
A lot of people uncomfortable talking about just like sex ed. They don't want it, it's too early. The school board would not allow a person to do naloxone training. The state of Maryland changed the age on Narcan, so I don't have to lie about that age and say they're 18 to give Narcan because it's happening. Because it's already happening. It's not in the schools because they believe it's not happening, which, again, it goes back to education, and the children on the street have more education about drug than some of us in this room. So again, drug users, children, very brilliant people when we get the opportunity to apply ourselves. And again, it goes back to the policies, and I found out about the crack law back in the day, and the rave law, when they detach parents from the homes. Who's growing up? I took care of my 3 younger siblings and made sure my father and mother had them hit every day. So that's a part of it also. And again, uncomfortable, scared to teach real knowledge or knowledge. Just acknowledge what's going on. And this everywhere. I don't think it's just a Baltimore City thing, an Annapolis thing, a Frederick thing. I've been uncomfortable to talk to children about knowledge that they already know what's going on. And it's called children like myself needed to be guided, and it's not there.
Okay, thank you. And I have a question in the back also, too.
It's actually not a question, sorry.
Oh, okay.
Because you guys are awesome, I don't have to ask you anything. I wanted to add one comment to this, and then I had another comment. I just wanted to say on the last panel, the woman was talking about adverse childhood experiences, and those traumatic experiences are most impactful to children between the ages of 0 to 2. So when we're thinking about interventions for children ages 0 to 2, what we're talking about is interventions for their parents. And we forget about that. We talk a lot about the children and prevention, and what's really important is that we keep those children in a stable environment. And if their parents are using drugs or have any other issues going on, we need to be addressing that. We don't necessarily need to be removing them from that situation. That shouldn't be the first step. So just wanted to add that. That was kind of on top of everything you guys just said. The other thing, Jesse and Will at the very beginning mentioned the Maryland Harm Reduction Action Network. I just wanted to tell you I have a listserv sign up if anyone loves emails. I'm going to put it over here on the front table, and you're welcome to come talk with me if you have questions. Had to make that plug.
That only cost you 500 mini-grant funding. So the other thing we wanted to add was that this lunch period that's coming up, as I'm sure you all smell the food, it's an opportunity, not just an opportunity, but you're pushed towards networking, exchanging information, because whenever we come together like this, it's an opportunity, it's an educational, teachable moment, but it's also an opportunity for peer-to-peer learning. So we're hoping that all of you all who not only work in this area, but are impacted by this area and want to do work in this area, that you actively seek people out, get information, exchange information. I do want to be mindful of time. That doesn't cut. Okay, that yeah.
Just a comment I want to make to Mr. Trader. One of the challenges, or I don't like that word challenge. One of the opportunities for growth I see is that we have got to partner and work together. Sometimes it's us and them. We have got to get to a place where we're talking about we. And if that doesn't work, we won't make it. I don't care who does what. I don't care how excellent you are in anything. I'll use Angel Trainer for an example. Angel comes to our Robinwood location and works with our children in our adolescent clubhouse. We're open. It will be 6 days a week now because we've just opened a music studio in Robinwood. So those are the kinds of things that we need to have together. Claudia mentioned it. If you have a building, we have several buildings. If you have a program that's going on, and I will say, you may not be able to go into the schools, but we have an MOU with Anne Arundel County Public Schools. It took us years to get it, but listen, we can go on the campus. In fact, my location in Brooklyn, they have turned my clubhouse into an Anne Arundel County Public Schools site. So children actually come with the principal, with the administrator, and 3 teachers Monday through Friday with the bus from Anne Arundel County Public School from 9 to 1:30. So we can work to do it and get it done if we learn how to work together and talk, not talk at each other, but speak with each other. Thank you.
Also, another way to assist in getting resources is to complete surveys, right? And utilize that other part, like additional comments. Write in there what you think your community needs, because it's someone's job to analyze those surveys and input it into some sort of database, and that will highlight your community, right? So don't look at it as annoying, because I know they can be rather long, but if the survey is in your community, then that means your community has already been scoped out, and we want more information so that we can better serve. Sorry.
So I just wanted to tell a quick story and then ask Claudia, because sometimes we talk about harm reduction, but we don't give any examples, right? So I've been fortunate to have Claudia explain what harm reduction was, because I didn't know. I actually had some concerns. Well, I fell in love, so whenever I have a chance, I go on the streets and I help. And then yesterday, I was doing outreach on Clay Street and Washington Street, next to the Stanton Center. So comes this lady, and we had the fentanyl strips right there. So she comes and she was very honest. She said, you know, I'm still a drug user, but I gotta tell you, can you give me more fentanyl strips? Because I will tell you what I did. I tested my drug, and it was red. Red means one line is red, it has fentanyl. And when I saw it was so red, she showed me a door. You see that door? It was red like that. So you know what I did? I threw my drug through the window, and you were like, good for you, you're taking care of yourself. So she's like, yeah, I'm not ready to stop right now, but I'm taking care of myself. So it's nice to see like those stories, then you can see, wow, and she's feeling good about herself. So that's one step for her to take care of herself, and who knows in the future. Thank you.
So you get up and you say something, and then they make you the moderator temporarily. I'm going to be quiet from now on. So now we need some recommendations. What are your recommendations? As you sit here and you think about what has been said, what's gone on today, what are your recommendations? What would you like to see?
I would like to see community involvement, particularly through AA-Power, right? So we have incentives for our volunteers. And you don't have to stand with us all 4 hours, but we are in Annapolis right now on the first and third weeks of the month, every day from 10 to 2. And if you can just come for 30 minutes, if you want to stand for 20 minutes, whatever you have to give, we would love to have you.
So Claudia, do you have a sign-up sheet for any of us today?
I have a sign-up sheet. I can give you information, phone number, whatever it is you need to contact us.
Thank you.
I just hope that we can perpetuate broader and deeper understanding of harm reduction. It should not be controversial. Our seatbelts in our cars are harm reduction. Sunscreen is harm reduction. You know, prom promise is harm reduction. Fences around pools are harm reduction. Life jackets are harm reduction. So harm reduction simply means that you carry on in life and do certain things that have a risk associated with them, and you minimize that risk because people deserve to have those safety nets. And so the full range of harm reduction services, and I probably won't name them all, but we haven't really gone through them. It is Narcan, and this county, city is great about that. The clean syringe programs, it's sort of shameful, frankly, that we don't have that. And then there is the test strips, and we've gotten better about that in the last year. But there are also low access buprenorphine methadone, not as treatment, but as harm reduction. And we're not very enlightened about that, I don't think. And then there's also safe consumption sites and just healthcare for people who use drugs, and acknowledging that they may not be ready, as Mike said at the outset, to go into treatment. Maybe they were in treatment once and failed. And so we just need to take care of them so that we can save their lives.
Thank you.
Brief history about Be More Power, how it began. And it started as a harm reduction class, which I was in the first class. And it started before me, 3 young ladies, one that works on the block in Baltimore City. Don't nobody know what the block is, with strip clubs, and 2 other young ladies, all in drug use. And expanded. My father came up with an idea. We went to New York, and that's when it happened. We came up with a name 2 years ago. Yeah, 2 years ago. But we've been in existence for a while, and it's like a handful of us. It's from people who still actively use to abstinence, and everything in the middle. People drop out, the people who hold up signs and things like that, a panhandle, we know them by name. We go talk to them, things like that. People who get kicked out of treatment, someone got kicked out of treatment for having brain cancer. And the reason was, had too many brain doctors, which is unreal. So it's about opportunity, thinking outside the box, having somewhere for the children to go, and having somewhere for people who use drugs to go and not out, but check on them, things like that. It's outside the box, untraditional things, and giving people who actually use drugs and can manage an opportunity for employment and professional development.
Thank you.
Here you go.
I agree with all of the interventions that Jesse mentioned, with all of us learning from each other, that Claudia mentioned, and with forming deeper partnerships and in loving all of our neighbors and not judging them.
Absolutely.
Yes, and I think the idea of collaboration is really central in this. And to give you an example of the environment I was privileged to work in, we were able to do a syringe exchange Narcan distribution site with a nurse practitioner who was able to prescribe Suboxone with a therapist on site, and this was a seamless site where it's up to 1 million have been served in the last 2 years. If you give the opportunity for people to come, they will take advantage of it. If you make it a safe space, they will come to it, but it takes the entire community to show up and give the resources.
So what I heard were the relationships, more collaboration. The things you're doing are wonderful. Do you know Deshaun Batson, who is one of the chaplains for Baltimore Police Department? Okay.
They be down the HSD all the time.
Break the stigma. Thank you all. You did an amazing job. Time for lunch.
How about this guy? I think me and Tola lost the job.